Recording in progress.
Madam Clerk, is that my signal? Okay, I'll go ahead and call this District Board of Health, Northern Nevada Public Health meeting to order. This is our meeting for Thursday, November 21st, and it's now just after 1 o'clock. I want to start off the meeting by welcoming a couple of folks here today. First is Paul Anderson, our friend from the city of Sparks, who was appointed yesterday to join our body. Paul obviously comes to us with a wealth of knowledge in local government and our regional government, so we're happy to have you and welcome, my friend. I'll also note for the record that Reno City Mayor Hillary Sheevy has joined us, and always a privilege to have you in chambers. And so welcome. You'll find it a very important board, and the folks who are here really care about moving the region forward. So we're glad to have you.
Thank you.
Okay, Madam Clerk, with that in mind, I'll ask you to start with a roll call.
Oops. Vice Chair Reese.
I am here.
Mary Luz Garcia.
Here.
Dr. Danko.
Here.
Steve Driscoll.
Here.
Paul Anderson.
Here.
John Clacking and Mike Brown are not. They're absent for today.
But thank you, Madam Clerk. We do have a quorum, and with that, I'll ask our friend from Sparks, Paul Anderson, to lead us in the pledge.
Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, item 3 is the approval of our agenda. For the body's sake, I'll note that item 10 has been pulled from the agenda and will be re-agendized for another day. With that change, can I get a motion for the approval of the agenda?
So move.
Second.
Okay, I have a motion and a second, and for those who are able to, let's vote on our screen, right, today? So I have a motion and a second. All those in favor, please signify by saying aye.
Aye.
Aye. Any opposed? Motion carries unanimously. Item 4, Dr. Kingsley, do we have some folks here for these wonderful recognitions on item 4?
We do. We're going to begin with new hires. We'll begin with Kelly Watkins. We'll have Director Dow come down and introduce Kelly.
Dr. Dow, welcome, and Ms. Watkins, welcome to you as well.
Hi, good afternoon. For the record, Nancy Dow, Division Director of Epidemiology and Public Health Preparedness. I would like to introduce Dr. Kelly Watkins, who has joined us this week as the new Epidemiology Program Manager for EPHP. So Dr. Watkins received a Bachelor of Science in Biology from the University of Michigan and did her Master of Science and PhD in Epidemiology from the University of Texas Health Science Center. She led a career that started as a laboratory assistant at Michigan Medicine before being trained as an epidemiologist with the Houston Health Department and as a research scientist at the MD Anderson Cancer Center. She was also employed previously as a surveillance investigator and HIV prevention analyst at the Houston Health Department before joining Southern Nevada Health District as a epidemiology supervisor between 2019 to 2022. And then prior to joining us at NMPH, she was a clinical epidemiologist through a joint appointment with UNR Medical and the VA Sierra Nevada Health Care System. So Dr. Watkins comes to us at a much needed time, and I am beyond thrilled to welcome her to the EPHP team.
Dr. Watkins, welcome, and go blue. Our middle child is a graduate there and lives in Ann Arbor, so we've sent all our money there. Go blue, as of you. Welcome, and we're excited to have you.
Thank you very much.
Thank you.
Thank you. At this time, also recognizing years of service, Anna Gonzalez, Office Specialist with 25 years here at Northern Nevada Public Health. 2 promotions, Chloe Dodge. She'll be moving from an Environmental Health Specialist trainee to Air Quality Management Specialist. And then Candace Brown from Air Quality Management trainee to Environmental Engineer 1. We do have 1 resignation. Adam Vasquez is an epidemiologist. Adam had a great career here, but by training, he's more of a microbiologist, and he will be moving to the Nevada State Public Health Laboratory, so we're happy to have that connection there with them as we continue forward and be able to work with our public health laboratory. Next, for Health Heroes, recognizing Tasha Pascal from CCHS for adaptability, collaboration, compassion, inclusivity, and trustworthiness. Sony Monga from CCHS for compassion and trustworthiness. Stephen Shipman and Jordan Marchi from EPHP for collaboration. Victoria Lagarde from EPHP for collaboration. Chad Kingsley from ODHO for adaptability, collaboration, compassion, inclusivity, and trustworthiness. And Jim English from EHS for adaptability, collaboration, and trustworthiness. I want to recognize that the great work that they've been doing and putting in and contributing to our community as well as our organization and our workplace. Also want to recognize as part of Washoe County, Gloriana Alvarez, who works in our department but received a Washoe Star of Award for her excellent customer service to those serving within both in here as well as the county. And then before we move into pictures and just recognitions, going to go ahead and turn the time to a proclamation, and I'll turn it back to Chair Reese.
Thank you so much, Dr. Kingsley. An important month, of course. November 2024 is Lung Cancer Awareness Month, so we'll now welcome Lily Helzer from the Nevada Cancer Coalition, along with Nicole Alberti. Are you here, Nicole? Yeah. Welcome, friends. Certainly a very important recognition.
Vice Reese and Vice Chair Reese and Board of Health members. My name is Nicole Alberti Sudi, and I'm with the Chronic Disease and Injury Prevention Program. And we are here today honoring Lung Cancer Awareness Month, and we have some kind guests from Nevada Cancer Coalition. Lily couldn't make it, so Sarah Grocki and Amy Thompson are here to accept the proclamation. And would you like me to read it?
That would be great. Thank
All
you
right.
so much. And I know it's
There's a
long,
lot of
so
whereases.
you don't have to read all the whereas.
Okay,
I can
there's
make
a
it
lot.
official, but it's
I
important.
really wanted our deputy health officer to read it, but she said no. Okay.
Smart lady.
She's smart. Okay, so whereas lung cancer is the leading cause of cancer death in the U.S. and Nevada, and whereas the American Cancer Society estimates over 2,000 Nevadans will be diagnosed with lung cancer in 2024, and 1,050 will die of the disease. And whereas risk factors that cause lung cancer, including smoking, exposure to secondhand smoke, exposure to elevated levels of radon, chemicals, or air pollution, or a family history of lung cancer, and whereas low-dose computed tomography, oh my goodness, is available throughout Nevada and can detect lung cancer early when treatment is more effective, and is recommended for adults 50 to 80 with a 20-pack year smoking history. And whereas Nevada ranks 47th in screening high-risk individuals for the disease, with only 1.4% of those high-risk and eligible for lung cancer screening in Nevada have been screened. And some people who are at high risk do not get screened for lung cancer because of stigma associated with lung cancer and lack of access to screening and treatment. And whereas people of color are more likely to be targeted by tobacco industry marketing, less likely to be diagnosed early for lung cancer, less likely to receive treatment, and have lower survival rates. And whereas sexual and gender minorities are more likely to be diagnosed with lung cancer, but less likely to be screened for the disease. And whereas those living in persistent poverty have a 16.5% higher mortality rate from lung cancer and are more likely to have higher risk factors, including cigarette smoking and less access to care. And whereas the Nevada Cancer Coalition and its many community partners are working to increase awareness of lung cancer screening, reduce the stigma associated with the disease, reduce the exposure to disease risk factors, and ensure more Nevadans receive lung cancer screening. Now, therefore, be it resolved that the District Board of Health does hereby proclaim the month of November 2024 as Lung Cancer Awareness Month in Washoe County.
Thank you so much. I know a lot of information
Sharon,
there.
words?
Yeah, this is Amy Thompson from Nevada Cancer Coalition. We just really want to thank everyone for acknowledging November as Lung Cancer Awareness Month and helping us all raise awareness for the importance of early detection for every Nevadan. So thank you so much.
Thank you so much for being here. Okay, and by this proclamation, I'll ask the body for a motion to approve.
Excuse me, Mr. Chair, it is not agendized as an action item.
Well, it says item 5, proclamations for possible action, but in any event,
There's only one, and it's up at the heading. I was looking for it.
it- no problem. I don't believe that proclamations have to be approved, but I was giving my colleagues the benefit of showing their support for lung cancer awareness. So I'll call for a vote. All those in favor, please signify by saying aye. Aye. Any opposed? That carries unanimously. Thank you so much to the lung cancer awareness folks and really for the Cancer Coalition for being here today. Okay, we'll bring it back to the body and now move on to we're going to step down and do a
Yep.
couple of pictures. So
We'll invite you guys back down for pictures shortly as once we get down there. And first a proclamation, and then we'll follow through with health heroes and new hires. So,
I'm going to leave this one. You don't
okay. No, I do not.
I might pop you on the nose if you give your own.
I know.
Okay. All right, here we go. 3, 2, 1. Got it. Appreciate you being here. Okay. Here we go. 3, 2, 1. Got it. Victoria. Got a pin here and everything. What's that? Oh, Vicky. Sorry. Here we go. 3, 2, 1. Got it. Thank you so much.
Kelly, sorry. We got a new hire. Come on, Kelly.
Right in here, right in the middle. Front and center. Okay, here we go. 3, 2, 1. Got it. Be well.
Okay, Madam Clerk, now a most important time in any meeting, our public comment period. Do we have public comment registered?
We do. All public comment is limited to 3 minutes per person and should be addressed to the Board of Health as a whole, not an individual. With the exception of the public comment agenda items, comments will be heard for items labeled for possible action and should be specific to the item being considered by the board. The District Board of Health conducts the business of Northern Nevada Public Health and its citizens during its meetings. The presiding officer may order the removal of any person whose statement or other conduct disrupts the orderly, efficient, or safe conduct of the meeting. Warnings against disruptive comments or behavior may or may not be given prior to removal. The viewpoint of a speaker will not be restricted, but reasonable restrictions may be imposed upon the time, place, and manner of speech. Irrelevant and unduly repetitious statements and personal attacks which antagonize or incite others are examples of speech that may be reasonably limited. For Zoom users, please log into the Zoom meeting via the provided link and utilize the raise hand feature during any public comment period. To provide public comment via telephone only, press *9 and *6 to mute and unmute. Reasonable efforts will be made to hear all public comment during the meeting. And our first public comment is Shirley Fulkins Roberts. She's the chair for the Board of Directors of REMSA Health.
Shirley, welcome. Always a privilege to have you. It's nice to
thank
see
you.
you as ever.
Shirley Fulkins Roberts, Chair of the Board of Directors for REMSA Health, and I wanted to just say today, congratulations to Councilman Anderson, Councilman Reese on your reelection. On behalf of our Board of Directors, which is a fantastic and very engaged Board of Directors, including all 3 hospital systems, we look forward to working with the board this year. And just a follow-up to your proclamation, as a co-founder of Northern Nevada Children's Cancer Foundation and a member of the board, I can't help but say thank you for declaring this as Lung Cancer Awareness Month. It's really important, and unfortunately, even young children are diagnosed with things like lung cancer, so thank you.
Shirley, thanks for being here. How did the gala go over the weekend? I had the privilege of attending the Gold Gala, the first annual.
The first
It seemed to
annual-
have been an incredible opportunity for us to raise awareness around children's cancer.
It was off the charts incredible. We're about to announce today what the net total was, but it's beyond our wildest dreams, and thank you for all the support from the community for that. So,
Well,
thank you
thanks
for
for being
attending.
here.
Okay, the second public comment is Mayor Hillary Sheevy from the City of Reno.
Mayor Sheevy, you need no introduction in
No.
this room, but we're happy to have you.
Okay, come on, you guys. I needed my platform
I
today.
can't see you, but pull that mic down.
They don't make these for short people. All right, well, thank you so much for having me. For the record, Mayor Hillary Sheevy. So nice to see you, my friend, Mr. Driscoll. I really enjoyed working with you, so it's great to see you back in public service. So what a nice surprise. And also congratulations, Mr. Anderson. That's exciting. You feel much better now that that's all behind you?
You can breathe.
Yeah, exactly. This is very sort of rare and unique for me. I have never spoken in public comment. I typically, my office is sort of one of those offices where, I hear everything, and so I tend to be able to pick up the phone. And I know that our commissioners are always willing, and I honestly think that we have been doing an amazing job regionally working together. I'm, very grateful for that. However, there are some issues that I think need to come to the attention, and so I think it rises to the level of me being here today. I am receiving a massive amount of concerns from businesses, whether it's restaurants to affordable housing projects. They are experiencing quite a lack of communication, and I think that that's very concerning. Whenever it gets to my level and we have to address it because it's the same constituents that you serve that I serve. And we're going to only be better if we do this regionally and we have a better approach. I did have a meeting with several, well, it was a big host of community members with Dr. Kingsley. And I was really hoping out of that meeting that we would come up with an action plan to make sure that we address some of these concerns. Some of the concerns were even minor, just about communication, follow-up, feedback, and that's not happening. And so I was hoping that we would have an action plan come out of that, but unfortunately, it didn't happen. So I called for a meeting, but we needed more time to put the agenda together, and so I honored that due to Mr. Kingsley's request. But I would like to make sure that everyone knows that I'm going to hold a meeting at City Hall December 5th at 1 p.m. And I'm going to encourage anyone that's experiencing some of these concerns to come and give their comments so that Dr. Kingsley can hear them and they can be addressed. Listen, I understand process. I understand safety. That all matters. I also appreciate the work that you do. It's not easy. I know every day people scrutinize what we do. However, I think we can take a collaborative approach. I also want to offer, and I know Councilman Reese has done a fantastic job of offering resources. Maybe that's what we need to look at. So I want to stay very focused on this issue because holding up these projects holds up jobs, a strong economy, and particularly the housing issues and the crisis that we're seeing. So I appreciate all of you. Thank you for allowing me to come. I wanted it on record to promote the meeting that we're going to have. I look forward to working with you, Dr. Kingsley, but I would ask this board to make this level of concern so that we can address our community as a whole. So I appreciate it. Thanks.
Mayor Sheevy, thank you so much for being here. Rest assured that Dr. Kingsley and I and the other board members take very seriously your being here today. I know how important this issue is to you because it's something that you've always been passionate about, cutting through red tape to make sure that our community is healthy, safe, thriving. All the things you said resonate with me entirely, and we'll get there together.
And all of you.
Absolutely, everybody on this board. Yep. We'll look forward to it, December 5th. We'll see you there. Madam Clerk, any more additional public comment at this time?
There is no further public comment.
Thank you so much. I'll close public comment then and now move on to the consent item. Are there any items that any of the board wishes pulled from the consent item at this time? Consent agenda? If there are none, then I'd ask for a vote on the consent agenda, the consent items.
Move to approve?
Okay, I have a motion by Ms. Garcia, a second by Mr. Anderson. All those in favor, please signify by saying aye. Aye. Any opposed? Motion carries unanimously. Okay, Madam Clerk, item 8A, is that next in order? Okay, welcome, Mr. Duplantis. Always nice to have you in chambers.
Good afternoon, Chairman Reese, members of the board. I'm Barry Duplantis, CEO and President of REMSA Health, for the record. I understand that you've been provided with a copy of REMSA Health's October report. For October and the fiscal year to date, REMSA Health has exceeded response compliance with Priority 1 calls in all franchise zones, that be in Zone A as well as Zones B, C, and D. Specifically, we were 91% in Zone A and 90% in BCD in the month of October. During October, REMSA responded to 8,258 Priority 1 calls and transported 5,295 patients to area hospitals, and that was actually up a bit over the previous month. But specifically, I just kind of want to put some character to that. That's 266 ambulance responses per day and 170 patients taken to area hospitals per day. So it just kind of puts things in perspective, because when I give you a large number, sometimes it's hard to put that in perspective to what does this mean in terms of impact to our community, traffic on the streets, care for services in the hospitals, et cetera. Our customer survey report for the month of September resulted in a score of 92.53, which was improved significantly over the same period of the prior year. That said, obviously, we continue to serve the community day in and day out, whether or not the wind is, Lord knows what it is right now, snow, rain, wind, sunshine, you name it. We are honored and privileged to be able to serve our community, and we thank you for being a part of our lives. I'm happy to answer any questions that any of you might have at this point in time.
Okay, Mr. Duplantis, thank you so much for the presentation and excellent report as ever. Let me ask if my colleagues have any questions at this time. I just have one comment, Mr. Duplantis. About a week ago, I had the privilege of being out for dinner with my husband, and we stopped at a restaurant which will remain nameless. But we ran into a couple of your ambulance drivers who were running in to get some food for themselves. And because I'm nosy and serve on this body, I asked them, some pretty pointed questions. How's it going over there? How are you all doing? How's work life? And boy, were they happy. They were just really grateful for the leadership that you and your organization exhibit. They're spread thin, right? They work hard and long hours, but they had joyful hearts. And so they were kind enough to allow me to buy a meal for them, and they were just really thrilled to be employed by REMSA and had nothing but good things to say. So thank you for that.
Thank you, sir.
Okay, can I ask Do we need an approval or acceptance of this item? Okay. Can I get a motion for an acceptance? Mr. Driscoll has moved for the acceptance, and Mr. Anderson has seconded that. I'll call for the question. All those in favor, please signify by saying aye. Aye. Any opposed?
Aye.
Motion carries unanimously. Dr. Danko, thank you. We hear you down here, and happy to hear your voice up there.
Thank you for having me.
Thank you so much, Mr. Duplantis. Okay, Madam Clerk, item 9 is a presentation, I guess, Ms. Charetz, are you here to what? Perfect. And with you is Dr. Eric Crosby. Welcome. Item 9 is a measuring air quality in smoking and non-smoking areas in Nevada casinos, potential exposure of minors to secondhand smoke, a presentation.
Vice Chair Reese, good afternoon, and District Board of Health members. My name is Lisa Sharetz. I'm a health educator in the community and clinical health services, working in youth vaping prevention and responsible cannabis use. I'd like to introduce Dr. Eric Crosby, who is on the faculty of UNR. He's associate professor in the Health Behavioral Policy Administrative Services in the School of Public Health in the Osmond Institute for Global Studies. Thank you.
Thank you so much, Dr. Crosby. Welcome, and certainly fortuitous that you're here on a day where we've also proclaimed this as Lung Cancer Awareness Month. So thank you for being here. Go Pack, and excited to hear what you have to offer.
Okay, well, yeah, thank you very much, Vice Chairman Reese, and welcome everybody. Good afternoon to the board. And I first just want to thank you for the opportunity to be here, have this opportunity to present some of this data, but also thank you for your service to each and every one of you. It is a lot of work, so I appreciate it as well. Again, my name is Eric Crosby. I'm an associate professor at the School of Public Health at the University of Nevada, Reno, so yes, go Pack. And today I want to present some research that we did looking at air quality in both Sparks and Reno casinos. And so this was supported by the Washoe County Health District, now Northern Nevada Health, which had a funding to look at youth prevention smoking. And so we wanted to look at the smoking exposure there. So I think all of you, this is our communities, right? We have casinos and different gaming areas. And for those of us that have been to casinos, like we usually typically think of, the blackjack card tables, the slot machines, the idea of, winning the 777s, getting that great luck. But really, casinos have changed over the last 20 years. Now we have some of the best restaurants. I personally love the Peppermill Atlantis. There's great spas you can go to relax. There's arcades for children. We even have ice skating rinks now at casinos at the GSR. So these have really transformed to friendly family environments, not your typical casinos. And I say that because smoking has also changed over the last 30 or 40 years. I think all of us are old enough to remember when we had smoking in airplanes and in hospitals and restaurants, and a lot of these have become now smoke-free because we know about secondhand smoke. And so just as a reminder, I think a lot of people think, oh, we're done with tobacco, but tobacco is still the most preventable cause of disease and death worldwide. 480,000 Americans die, and more importantly, 41,000 people die of secondhand smoke. So these are people who never smoked a cigarette in their day of their lives that are being exposed to these harmful chemicals and toxins. You may have heard industry representatives or casino people come in here and say that you have these big ventilation systems that can prevent the smoke. But again, the Surgeon General's report, the CDC, the FDA, and even the company that makes the ventilation systems have said that there's no safe level of secondhand smoke. And so what we wanted to do is, I've talked with a couple of you council members before about getting local data about what, because we know about secondhand smoke, but what does that mean for our local communities? And more importantly, what does it mean to those that frequent the communities and minors? And so what we did is we went to 14 casinos here in Reno and Sparks. And so we looked at both gaming and non-gaming areas. We would visit each casino for about an hour at a time, because that's typically how, if you go to a spa or you go to a restaurant, you're going to frequent for about an hour. And we visited 6 different locations at 10 minutes each, measuring the air quality and what people are exposed to in terms of secondhand smoke. And we did one of these 6 areas as a control area, so we had background, so we knew what good health was and good air quality with outdoor areas. But then we also looked at gaming areas where the slots, blackjack tables, but also non-gaming areas like those spas and arcades where others that don't smoke frequent. And then one other thing we did was we also counted the number of smokers that are actually present that we can visually see that are polluting the air to know, okay, like how many people actually are smoking. And we wanted to see how many minors were actually present because this was part of youth smoking prevention. And so we use this little app note tube. It's a little device you can hold in your hand, as small as this. And they have an app where you can measure the in-quality air. And so, it can get very technical and scientific, but I think most people are familiar with this. This is the Air Quality Index from the Environmental Protection Agency that basically show like different qualities of particulate matter in the air, which we measure as PM 2.5. But for our purposes here, good quality is measured in this kind of 0 to 15 range, 15 to 40. And so once we get to these higher levels, this is what we really are concerned about. And so you can think about this when you have the air quality, when we have our fires or other things, we can look on our app and see the different quality there. And so I'll be using this throughout my presentation. So what we found was if we looked at all 14 casinos, here in the blue, you can see that there's median levels of exposure, which may not seem that harmful. But in the red, we also measured peak levels. So imagine, you're only there for an hour. There may be times where there's not much smoke, but there's a lot of times where the smoking is going up. And so I don't know if you can see it so well, but in the kind of orange peach color is what we measure kind of this 40 to 65 range of particulate matter for unhealthy, for sensitive groups. So these are people who have asthma or other acute health risks that really have a struggle. I have a good friend who won't even go into a casino because she has asthma, and so she can't even go to the restaurants or the spas or these other places. And so this is what we saw across the board. When we go a little bit deeper, we wanted to understand, okay, we know that there's secondhand smoke exposure in the gaming areas, and we found that. So if you look at this casino, casino number 5, it's very unhealthy for sensitive groups. So these are the people who have, asthma. And so this is what's expected. And, you go into where the blackjack dealers are or the table games, the slots, you can even smell the smoke. But what was really surprising is when we went into the non-smoking areas, so these are the arcades, the spas, we found in the exact same casino higher levels of exposure level. And this is new data. This is something that didn't exist in casinos before because they didn't have these arcades and these spas as much as they do today. So this is kind of a new thing to think about. So when we think about the social injustice, the poor bartender or blackjack dealer, now think about the person who's working in the spa or working in the arcade that's being exposed to secondhand smoke on a daily basis. And these are really new findings. And then we went deep into each of these areas. And so not to talk about all the data, but if you look at, the hallway or the tables, you see some, really high exposure levels. And again, we were seeing minors present in all of these locations. So they're being exposed in these even short durations. And you can see here at the bottom, right, unhealthy, 65 to 150, and unhealthy for sensitive groups, 40 to 65. What was really interesting is that we also counted the smokers. So when we did not actually see a smoker present, but we were in a restaurant or we were in a restroom measuring the air quality, we were still seeing high peak levels. So what does this mean? This means that the smoke with no smoker is being trapped in the air. So the ventilation system may be getting rid of the smell, but it's not getting rid of the smoke. And what's happening also is when you go into areas where we went to, where smoking is not allowed, so like a lobby, we still saw a smoker, but who's going to police that smoker? And if you go into places where they have these skyways and things, it's very hard to know where one can smoke and where one cannot, and who's going to police that. And so it becomes an enforcement issue where you have to kind of police where smoking doesn't exist. And again, these graphs are a little bit hard to see, but it just explains the smoker present and whatnot. So here in orange is where we did see smokers, but even when we didn't see smokers, you still see very high peak levels of exposure. And then finally, we counted the number of smokers, and I was actually really shocked. Working in tobacco control for the last 15 years, going to casinos, I would have thought there was, 50, 100 smokers that would create all these high levels of exposure, but no. Most of the casinos, if you take out Casino 14, where there was 20%, only 7% of smokers were present when we were actually collecting the air quality. So again, if you could just give you one example, If you had a room where we went, where there's 129 people, you only have 4 smokers, just 4, so 3%, the small minority, 20 minors present, and they're contaminating the entire air, right? So the air is being trapped. The ventilation systems are not working, and again, it's a small number of smokers, or no smokers, right, in some of those areas that we see. And again, this is another graph to illustrate this, where you have the number of smokers, the minors, and the total patrons. So in conclusion, this particulate matter, these chemicals that are being exposed that do cause all kinds of diseases, are high regardless of ventilation systems and regardless of whether there's small or no smokers present. That's really important. So we're having minors, workers, people who work here on a daily basis. Again, don't just think of those blackjack dealers, people who are in the smoking areas, but those people that are in the non-smoking areas. And I'm worried about some of my friends that actually work at the Peppermill and the Atlantis, that work in offices that think they, and again, we didn't measure every location, but this is alarming data. And again, the only really way to really eliminate this is to establish 100% smoke-free casinos like we have seen with bars and restaurants. And so as casinos have adapted and evolved, the hope is that, smoking laws will adopt, to protect the people in these communities. And then I just want to end by saying there's a nationwide momentum going around smoke-free casinos. I was at a meeting about 3 weeks ago in Philadelphia, where I actually got to go to a smoke-free casino. It's called Prax. It's in Philadelphia, and there's also Park MGM in Las Vegas. I learned about New Jersey, Atlantic City. A lot of these places are starting to go smoke-free. And so just want to let you know there's a big momentum. And just really hearing from the actual workers who work in these places. I mean, just the dramatic stories was just encouraging. So anyways, thank you so much for the opportunity to present this data, and happy to answer any questions if there's time.
Thank you so much, Dr. Crosby. I think very important information, and the arc of human history bends towards the light, right? And so Thank you for sharing your information with us. Let me ask my colleagues if they have any questions for Dr. Crosby. Mr. Driscoll, the floor is yours.
Thank you, Mr. Vice Chair. With the scrubber systems that are inside the casinos, is there any outside air that joins and contaminates what they're scrubbing?
So from what our studies show, that those are very minimal from the exposure. So we couldn't measure exactly what was the cause of that. So there could be some exposures of that way. But in some of the locations that were far away from this, because we looked at all different casinos, big, small, old, new. And so some buildings were more exposed to that, so we couldn't tease that out, but there was others that didn't. And so our data showed in those other locations, it was resulting similar results. So we could at least conclude that was not enough of a co-founding variable that would interfere and cause some of those problems, if that makes sense.
Thank you.
Yeah.
Okay, Dr. Kingsley. Oh, Ms. Garcia.
Thank you so much for the presentation. I see that you have a variety of casino sites that were integrated in the study. What percentage of the overall casinos is reflected in these?
Almost 100%.
Almost 100%.
That's almost all of them. Yeah, I think there was a couple that we didn't go, and we didn't want to publicly name the casinos because we want to work with them and we want to find a solution that works for everyone in the community. But that does represent, if not 100%, a really high proportion.
Okay, thank you.
Very interesting. Okay, Dr. Kingsley.
Some points, just want to, in consideration, many times, we always see an easy fix, but sometimes, there's various angles to come at points, So part for the health district, you can see, let's break it down larger to demand and supply, and are we enabling our citizens to request of those services, saying, can we enable them to give a voice to say, I really want a smoke-free casino? Because then it's demand, right? And then those casinos are going to say, like, well, I'm getting a lot of demand for this. We're going to go smoke-free. And then if we get a smoke-free casino, that shows in a good example. So it's part of working with the community, too. So some great information, and appreciate it for it. Thank you.
Great. Yeah, thank you.
Okay, Dr. Crosby, thank you again.
All right, thank you very much.
Appreciate it. Okay, I'll bring the item back to the board and close item 9 and move on to item 11. Item 11 are our staff reports and program updates, and I'll welcome first Mr. Vega from Air Quality Management. And Mr. Vega, while you're coming down, thank you so much for your service on the Truckee Meadows Tomorrow Board. We did receive, prior to the meeting, the Connecting Data to Life Community Progress Report, and it was very, very informative, but I noticed your picture in there as being part of the board, so thank you for that.
Thank you, Vice Chair and members of the board. For the record, Francisco Vega, Director of the Air Quality Management Division. First, I'd like to welcome Councilman Anderson to the board. Looking forward to working with you. In regards to my report, just a couple of things to highlight. First, I'm happy to communicate that we had no exceedances of any of the standards for the month of October, so that's a positive. My team and I also had the opportunity to attend the October 22nd Washoe County School District Board of Trustees meeting, where they approved the MOU for our donation of the battery-powered landscaping equipment. So remember, you guys, the board approved the funding part of that project. This was the school district's part in approving that MOU. I think the equipment is starting to trickle in at the school district, and we'll do some more kind of press opportunities once they have received all the equipment, but just wanted to communicate that. Let's see. One thing that you might notice in my report is we've started including plan review in our commitment to process those in a timely manner. And so we provided information for this entire calendar year all the way through October. And again, I'm happy to report that 99% of our plan review projects were completed in a timely manner. Lastly, I mentioned last month that we're going to have some openings on our Air Pollution Control Hearing Board. We did send a press release out. I do believe I forwarded that to most board members, but just want to reiterate that we do have upcoming vacancies in the at-large positions, the attorney, and the licensed general contractor positions on our board. And while we are always accepting applications, in order to be considered for these positions and these openings right now, we are going to accept applications through December 5th. So just wanted to communicate that. So that is my update. Happy to answer any kind of questions.
Okay, do my colleagues have any questions for Mr. Vega at this time? Okay, thank you, Mr. Vega. I appreciate you. Ms. Latres, welcome.
Good afternoon, Lisa Latritz, Division Director for Community and Clinical Health Services. You have my report, and I have nothing to add today, but happy to answer any questions.
Well, thank you so much, and happy Thanksgiving. Maybe that's what you were here to bring forward. Does anyone have any question for Ms. Latritz? I thought the report was very excellent, so thank you for that. Okay, I'll close out 11B and move to 11C. Mr. Fida, welcome. Mr. Fida, you've been very busy, and I want to be able to say thank you for the work that you're doing. What happens on this side of the lectern and dais oftentimes is we get these frantic calls, and they always seem to come at 4 o'clock on a Friday afternoon, and someone says, I've got an issue, and you've got to fix it for me. And this last maybe a week or so, 10 days ago, you did fix that issue well into the evening. And so I want to just say thank you. Thank you for your continued service and commitment. It's oftentimes only the negative that we hear, so I want to make sure you know that I appreciate you and the work that you're doing and the good work that you're doing. So thank you for that.
Thank you, Vice Chair. So I wanted to just highlight a few, or I guess welcome to our new board members. Good afternoon, members of the board. My name is Robert Fido, for the record. I wanted to kind of highlight a few things in my report. Just let the board know that vector season has kind of wound down. Our staff have essentially finished the last of their sampling for any mosquitoes, so we're winding down on that. Right now, they are kind of doing spot testing. Recently, they tested a squirrel that was exposed potentially for rabies and plague. That exposure was negative, so thankfully. The other thing I did want to highlight, and I think will hopefully maybe help the board and provide some insight into maybe Ms. Sheevy's comments, is some of the plan review data. I've kind of highlighted and detailed some of that data more in my report. You can kind of see the percentage of completion, number of reviews we do, types of reviews, and also kind of a breakdown of what types of projects we do, whether it's new permitting, new builds, or tenant improvements, remodels, or even revisions. And so that data is available for the board. I'm happy to report that this month our plan review numbers were about 90% completion for plans submitted within a 2-week turnaround. And I did want to highlight staff's work. Staff were able to come to a resolution regarding some lighting concerns on a pool. Staff were able to defer some of the lighting concerns, and they worked with the developer and contractor to end. Instead of working in the planning phase, they will do a field verification at the end, just to verify that there is an adequate lighting on the deck. So I want to give kudos to staff for working, finding new solutions to these problems. So another one I did want to highlight is some of the food team's work. A lot of our staff, they try to be proactive. So the food program received 3 complaints against a restaurant within a 30-day window. So they did a environmental assessment and routine inspection. They did find substantial issues. They ended up issuing a fail score to that facility, and they sent the facility to their AMC course to get some additional training and tools to help them kind of turn it around over there. So, and that is kind of the highlights of the report. We'll open it to the board for any questions.
Okay, do my colleagues have any questions or comments at this time? Mr. Vita, I'll then just say, look, you're very rarely going to hear all the good things that your folks are doing, that 90% turnaround, all of those things. It is the harder ones that become an issue, right? And so please understand that when Madam Mayor comes to chat and we have some issues that we've got to address, it is not anything personal or attack on your work performance or product. We simply need to move forward as a community together. And so I appreciate the information you provide in your report. You've done that now the last couple of times and been providing some of that information. I think it will help us as a board to be able to make better policy choices when it comes time to budget, right? Because if one of the things that I think is a consistent theme over time, whether I was on Tumwa, the city of Reno, or here, is that if we don't give you the right tools, pretty hard for us to ask you to do your job the best way. So some of that falls on us as a board, and we have to exhibit greater leadership in order to move the things forward that the community really is demanding. So please understand that I am very excited for the changes that we'll be discussing at this body, some of the things that we've really got to do to make sure that we are providing the best customer service to our folks in our community. So thank you for that.
Yeah. Thank you, Vice Chair.
Appreciate it. Dr. Kingsley.
Thank you. Just wanted to, don't have a light on mine. So just wanted to say thank you again for Rob and your staff. They've been very responsive through this internal process as well external of working towards solutions. And I want to thank Mayor Sheevy for coming. And, I often say closed mouths don't get fed. So very much so that we are working towards solutions. And I do want to continue to reinforce Mayor Sheevy's invitation that community partners please come on December 5th at 1 p.m. at Reno City Hall so that we can present and work toward viable solutions. So for our community to both enhance for those that live here and those that visit. So appreciative of all those points, and thank you very much.
Mr. Fida, thank you for your report. Appreciate you. We'll close that item and welcome Dr. Dow.
Good afternoon, Mr. Vice Chair, members of the board. This is Nancy Dow, Division Director of Epidemiology and Public Health Preparedness. You have my report. I have nothing to change or add, just a few highlights as we're going into November. So in epidemiology, both flu and RSV started to show some upticks as of mid-November, but are still remaining overall low, and influenza-like illness activities are remaining below Region 9's baseline, so that's all good. Similar trends are seen on the state level and nationally as well. The majority of our flu sequencing in Washoe County are showing flu 8, H3 sublineage so far, followed by H1N1 sublineage. COVID cases reported and hospitalizations still remain low at this point and stable. In the month of November, we have seen an increase in outbreaks declared compared to October, majority being gastrointestinal illness. We've not yet seen an increase in respiratory outbreaks, but would expect that soon following our usual winter patterns. Also earlier this week, the epidemiology program published an Epi News distributing the most recent CDC Health Alert Network awareness due to the first Clade 1 Mpox diagnosed in the U.S. And this was a California resident with recent travels to areas experiencing outbreaks. So far, this is the only case we're aware of. As a reminder, the outbreak in the U.S. that started in 2022 was Clade 2. The Clade 1 Mpox increase in Central and Eastern Africa has been ongoing since December 2023. So today, there have been a few travel-associated Clade 1 Mpox reported in other countries, but they remain isolated and in close household contacts without general spread. So these are all good, and we're hoping what's ever happening right now is going to be pretty isolated. The EPI team and the CCHS team are prepared and are keeping an eye out for any cases and any public need for PrEP or contact need for PEP of the Jynneos vaccine. So that's all my update. I'm happy to answer any questions.
Dr. Dow, thank you. Let me ask my colleagues, any questions for Dr. Dow? Yes, sure, Dr. Kingsley.
Thank you. I just wanted to show the conjunction of working together, both add a little bit to Director Latrice's report, just that the immunization clinics are provided throughout our community at all levels, both for flu as well as COVID, have been highly successful this season. And our numbers are very low at this time, so we hope they continue at that point, on those points. And so as individuals move into our holiday season, and rightfully so, spend time with friends and family, just a reminder to wash your hands and take precautions so that we can continue forward in this season and keep those loved ones close and healthy. So thank you.
Thank you, Dr. Dow. Appreciate you. And now we'll turn to the Office of the District Health Officer's report. Dr. Kingsley.
Great, thank you. Just a few points to point on, but just wanted to note on there as prior authorization to the board, just a few fees that are indicated that had to be changed or required, just for normal business that we have, especially within our community and clinical health services. Besides that, just wanted to acknowledge our partners and the partnership that we have in working through a very challenging situation with the Lake Mill Lodge, and really addressing the needs of those residents that were there, and working with our human and health services for correct housing, and so that they can have opportunities to progress and thrive, as well as, help, and that we have a help me up on those points. And I see the community working together on all those points and how it was responded. And I just want to recognize our partners as well as our staff here in responding to that very challenging situation. And then just indicating that the district is moving very well into a new language access, both directly translated through a type of AI system called Wordly, when individuals come in, as well as a language line that we continue to have, but offering any community members the opportunity to come in and speak in their native language to receive services as needed. So happy to comment on that just for the progression that we have that. And overall, that's it. I'll entertain any questions if you have any.
Dr. Kingsley, thank you so much. Does anyone have any questions for Dr. Kingsley? Okay, thank you so much. We'll close out item 11E and move on to board comments. Do any of my colleagues have any comments at this time? Okay, I'll have just a couple. The first is that I imagine item 10, which was pulled from this agenda, may come back at a future agenda, and so we'll look to see that at another time. Second, the chair and vice chair selection will be on the agenda in the December meeting. And last but not least, it looks like our December meeting will be on December 19th, just shortly before the Christmas holidays, and we'll do also at noon a groundbreaking for the TB clinic. So make sure you hold that on your calendar, and we'll make sure that we get you information about that. So that would be the groundbreaking for the TB clinic at noon, followed by our Northern Nevada Public Health District Board of Health meeting here in these chambers at 1 o'clock. And with that, we're adjourned.